AIM-listed Orphan may be about to come into its own. It's creating what it calls a growing European pharmaceuticals company with a platform of specialised services, including orphan drugs. Orphan has recently acquired hVIVO, the largest quarantine clinic in Northern Europe. Cathal Friel is Executive Chairman, and he joins us now. Cathal, welcome.
Thank you very much. Pleasure to meet you.
Good to talk to you. First of all, explain the spread of the company, because my understanding is you've acquired little bits of businesses and so forth, and you do quite a lot. What is it that you're offering investors with the current business setup?
Okay, Jeremy, what we would say is that we're acquiring small, struggling, AIM-listed companies. The first one we did, we acquired Venn June last year, and we've turned it around. It came with 14 million revenues, but massive losses. Those losses are now gone, and now we've acquired hVIVO. We came with even bigger losses, but again, ironically, about 14 or 15 million revenue. We put the two together last week under Orphan, and today we've now a company, a services company. We're focused very much on pharma services that did 30 million last year. So now it's make sure that company is profitable in the next couple of months, and we're going to have an exciting time.
Now, you're an entrepreneur. You're not a specialist in this area. So what are you doing in order to make sure that these areas are run correctly to the best advantage of shareholders in Orphan?
Yeah, I love that question, Jeremy. I hated being CEO this last 12 months.
Right.
I had a lot of reportees. I was very good at losing reportees, slashing and burning. But we now have a proper CEO. I'm executive, full-time chairman, so I'm going to stay very involved. I've half of my net worth tied up in this, put my money where my mouth is. But yeah, no, we've got Trevor Phillips, a full-time CEO who came with hVIVO, and we've Tim Sharpington, a brilliant full-time COO, deep, long experience in the pharma services business. So yeah, they know what they're doing. And then we've, in recent days, announced we brought somebody back from the past. The original founder of hVIVO is Professor John Oxford, and he's a world-renowned virologist. He did a lot of work in SARS, a lot of work in the MARS epidemic. He's now coming back as an advisor to the company, as a consultant, and probably more an advisor to me to teach me a bit about what's this virus business all about.
I said at the top, it's possible that you may yet come into your own because of obviously the coronavirus. I want to get onto that in just a minute. I want to pick up though first of all on the point you mentioned about Venn. What is it that Venn does that could and will ultimately, hopefully, generate some income and profitability? Yeah,
look, Venn is what's called a CRO. As a clinical research organisation. It does preclinical, tells drug companies how to make their drugs before it goes into the clinic, that means trials, and it runs phase 1 and phase 2 trials. Venn struggles to get enough work. There's too many staff. I've now, unfortunately, got rid of a lot of them this last year, so hence we're becoming profitable. Despite losing 40% of the staff, the revenues have gone up. Funny that. That means we're taking out the pen pushers, middle management, but it's providing that. hVIVO, in turn, provides challenge studies. That's how to test vaccines. It's very similar studies to an orphan drug. You take 100 patients, you basically put them into a clinic in Whitechapel, and over a 2-3 month period, very quickly, you will know if a vaccine works, which is, again, appropriate in the current environment. The one difference is it's a very sticky work, and they were always asked to provide phase 1 trials, phase 2 trials, and clinical trials. They couldn't do it. And guess what? Venn is always looking for that work. So putting the two together, we now have a business that works both sides.
This company is still called Orphan. I did mention at the top that you have an association with some orphan drugs. Is this going to be a core part of your business, or is that always going to be a minor part? Because obviously with Venn and with hVIVO, you've gone in a slightly different direction.
Yeah, look, we did IPO, we still are. A lot of our customers are orphan drug companies, and we're never going to develop our own product. That's what happened to hVIVO. We're always going to be a services company. We do have some products in the background in hVIVO. We call them our lottery tickets, but they'll be farmed out, licensed out to big pharma, and if they work, great. If they don't, we're not going to lose any sleep. Our focus is on providing services to pharmaceutical companies. That includes orphan drug companies, but now with hVIVO, they're the world leaders in providing challenge studies to vaccine companies. So we're going to be jointly orphan drug services and vaccine drug companies.
Just staying on the orphan drug aspect, my understanding is orphan drugs is that they try to meet a currently unmet need within a very niche market. That is, they more often than not don't actually ever make any money, and they're partly government funded. How are you approaching the orphan business? Because I've yet to meet anybody that actually makes any money out of orphan drugs in its own entirety that gets sponsored by the government.
Yes and no. That's a good point on orphan drugs. We're providing services to orphan drug companies. It is the fastest growing pharmaceutical sector.
Right.
Believe it or not, it's the most profitable. Just look at my little company. When you and I met many years ago, I had a thing called Fastnet. I reversed Amrid into it 4 years ago. 3 years ago, Amrid was focused on orphan drugs, had no revenues. Christmas, Amrid did 150 million. It's one of the better performing AIM companies. So that'll show you the trajectory that orphan drugs, you can go from 0 to 150 million in a very short. You're right, a lot of the orphan drugs do get government support, but that's because there's a small population base of very sick people, and it does need, but the companies make a lot of money from them.
hVIVO, tell me a little bit more about this, because this to me, from my first view of this, thinking the timing of this looks good in terms of the coronavirus. Obviously we're very much mindful of the human impact of that, but you're there to try and find ways to try and combat these dreadful things. Is there any connection between what's happening and ultimately business that you could well come up with?
Yeah, Jeremy, look, being honest with you, I think I said to you earlier, there's a Margaret Thatcher comment, the harder you work, the luckier you get. Right. And being honest, the hVIVO acquisition, we did it in record time. It was 38 days from start to finish. We announced the takeover till we acquired it. It's the fastest takeover on the London stock market of one public company of another. We didn't take it over because we thought it was going to be topical. Vaccines was a Cinderella industry up until 3 weeks ago. Suddenly the world's waking up. Vaccines is now in the eye of the storm. The whole corona thing is very sad and very unfortunate.
Of course.
But we do have, uniquely, the only 24-bed quarantine laboratory in Europe, our quarantine clinic, has 24 distinct bedrooms and on-site virology. So we are already in active discussions out of the blue with parties from all around the world looking to work with us. And this was a company that struggled and struggled, and then suddenly it wasn't our hard work. We were lucky. We were just the right place in the right time. And hopefully, the corona is very sad. It's very unfortunate. But hopefully our very skilled personnel, the lab and the clinic may be of use in the coming weeks and months ahead.
Do you see this business expanding then? I mean, if you do start to fill the beds that are available, my understanding is what, limited numbers, 24?
24 bedrooms.
Yeah, so if you are inundated with business, is there the capacity within your organisation to expand and replicate what you've done with hVIVO and bring in more beds?
No, I think, look, our policy would be no more fundraising, no more acquisitions. Look, we put a nice company together. Those 24 beds, the problem with hVIVO has only been 30-35% occupancy for a long number of years. You can understand the occupancy is going to go up. Renting that clinic's like renting a hotel. If your hotel is 35% occupied, it's not going to make money. Our target very shortly in the coming weeks and months, get that up to 75%, then hVIVO will make substantial cash. Furthermore, the big issue with hVIVO is it hasn't announced many contract wins in this last year or two, one here and one there. We made it clear to the market that hVIVO is now on sound financial footing, and there will be something wrong if we're not announcing substantial transactions in the near future with hVIVO.
And is this going to be any cost to you? What do you I think you've got about, what, 5.5 million, I think, on the balance sheet, haven't you, at the moment, in terms of cash?
Look, the hVIVO was a stunning acquisition. Our friend, Mr. Woodford, poured 113 million into it. We acquired it this recent months for 10% of invested capital. Of the 113, yes, half of that would be wasted. But I think there's 50 or 60 million of assets. The clinic replacement cost is 30 million. They have a laboratory replacement cost 7-8 million. And then it has the world's largest bank of virus challenge study models. And our lawyers verified they could be up to 25 or 30. So there's 50 to 60 million real assets we acquired for 13. Not bad. And even better, the company came with a couple of million cash. And then we raised, the raise was quite unique as well. We publicly announced 2 weeks ago we would raise money. Normally the share price goes down. I publicly underwrote it with my personal cash to the tune of 2.5 million. And as part of the raise, I put in an additional 300,000. And guess what? Our share price went up and we were oversubscribed. We raised 5.3 million.
What is your interest now in Open Orphan then? What percentage do you own?
I've well over 10% now post the fundraising.
I mean, that's very important. When pitching a company to anybody, you've got to make sure that you have a responsibility and a liability, I guess, in the share price. Let's bring up the share price, because I think it's important to look at this. In fact, this let's take it back to some of the recent activity. This is since the beginning of 2019, when you were at 1.6. You're now at 6.3. This is the London listed, AIM listed stock. What is priced in at these levels? Because you are talking potentially about some brisk business this year. You're a money man, a numbers man. What can you tell investors about the hope for payback for those that get in at 6.3 pence?
Okay, well, what are we valued at? So today, we're a company that did 30 million in this past year, the combined entity. All our competitors, our peer groups, are at 2, most of them are 3 times revenues. We're around 30, 33 million, we're about 1 times revenue. So people buying in now, if we can prove in the next weeks and months we can make it profitable, that share price should re-rate, go from 1 times revenues to at least 2. And we're lucky, could go to 3 times revenues. So they're coming in. They're coming into a company that has been massively loss-making. I wouldn't have put big part of my net worth in the line. I didn't think we could fix it. One good thing finance people can do, we can slash and burn. There's been a lot of that done. I think it's nearly fixed. So the next stage is now we've got professionals, Tim and Trevor, running the company, keep me out of the way. But I'm very much hands-on. I will manage investor relations, I'll manage a lot of the business development, and I'll work with, Professor Oxford to try and see can we get more opportunities out of China, out of what's going on. So I think coming in, they're coming in at 1 times revenue. Our peer group with 30 million should be 2 or 3 times revenue. We're coming into a loss-making company that we're saying will be profitable very soon.
And what are you talking about to investors in terms of some of the milestones to watch out for that check you're moving in the right direction?
2 things. I think hVIVO, I said a few minutes ago, haven't announced many deals. They do chunky deals, 3 to 5 million and bigger. There's something wrong in the coming weeks. And I may be a very angry man if I don't, but I'd imagine we would expect Orphan will be, or not Orphan, hVIVO. They've a lot of deals sitting that couldn't complete because the balance sheet was busted. We now have 5.5 million sitting there. So milestones, announcing deals, particularly with hVIVO. B, Orphan announcing further deals, and this with big multinationals. And C, going profitable. That is the key inflection point, and we're going to make sure within a short number of months, come hell or high water, this will be a profitable company.
Okay, all right, Cathal, it's good to talk to you again. Thanks indeed for joining us. Cathal Friel is Executive Chairman of Orphan.